Guyana today received 52,800 doses of the Pfizer vaccines for children ages 5 to 11 years old. This shipment of vaccines was donated by the government of Spain and arrived this morning at the Chedijagan International Airport, where it was officially handed over by Ambassador of Spain, Fernando Nogales Alvarez, to Minister of Health, Dr. Frank Anthony, and Education Minister, Priya Manikchand.
This is part of a worldwide global effort that we are having in Spain, that this is something that we take very seriously, has unanimous support from our parliament and our society. The first phase of the pandemic was truly hard for Spain. And out of that feeling of despair, of not knowing what was happening, there emerged the need, the very intense desire that whenever a solution could be ready, that we had to share it with those who needed it most.
In expressing gratitude on behalf of the people and government of Guyana, Minister of Health Dr. Frank Anthony acknowledged Spain's previous contribution of COVID-19 vaccines for adults and Spain's gesture of supplying this shipment of vaccines for Guyanese children amid high global demand. Dr. Anthony noted that the vaccines are specially made by Pfizer for children of the 5 to 11 age group and is 1/3 of the adult dose.
There's a myth that children don't get COVID. But when you look at our statistics, there's 60-something thousand persons that would have been infected over this period. About 1/3 of them would have been children. So we are starting on Saturday, and then we'll collaborate more closely with the Ministry of Education to roll this out in different schools. But we are really dependent on parents to make sure that they come, they give us permission so that we can do these vaccinations.
The first set of vaccines would be rolled out on Saturday at the National Cultural Center Tarmac, and Dr. Anthony is urging parents to grant their children the permission required to get vaccinated. Dr. Anthony also reminded that the vaccines prevent against severe illness and long COVID. Meanwhile, Minister of Education Priya Manikchand also voiced her appreciation for the donation of the vaccines, which is a valuable gift.
Vaccines will remain voluntary. So to all the parents listening to us, vaccines will continue to be voluntary. And we are not insisting that anyone takes the vaccine, but we are encouraging you strongly to pay attention to the data. Most of us want better for our children than we want for ourselves. And I urge you to consider strongly taking this, getting your children vaccinated with this vaccine. There are limited doses and they will finish. And so an early decision would be required.
Guyana is one of the first countries in this region to access vaccines, as there is a global shortage. Dr. Anthony had mentioned last week that the vaccines will be rolled out on a first-come, first-served basis. Because of the first and second dose administration, 26,400 children will benefit from these vaccines. Dr. Anthony noted that based on the uptake among children, efforts will be made to access more vaccines.